everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to be going over diabetes mellitus, specifically the nursing management. What I'm going to do is I'm going to focus specifically on the things you need to know for the NCLEX exam and your nursing lecture exam. And after this video, be sure to go to my website, RegisteredNurseRN.com, and take the free quiz that will test your knowledge on this material. A card should be popping up so you can access this. Now, this video is part of a series about an NCLEX review over the diabetic patient. In the previous video, we went over the pathophysiology, the causes, the complications, the different types, the nursing assessment, and things like that. So if you haven't watched that video, be sure to watch that video after you watch this. Okay, so let's get started. First, let's begin by talking about the nurse's role when you're taking care of the diabetic patient. Your role as a nurse is to educate, to administer medications, to assess and monitor them. And the best way to help you learn this and help your patient learn this is to follow the triangle of diabetes management. And it's a little triangle, it's continuous because everything works together. You have diet on one side, meds on the other, exercise, and in the middle you have monitor. Because based on their diet and how they're exercising will determine what type of medications they need, especially within that type 2 diabetic, because a lot of times they don't even need medications if they can manage their diet and exercise. And then all through that, you're going to monitor exercise. They're going to make sure that their glucose is good before they exercise. If not, they're going to eat a little snack and they're going to monitor their glucose. So all of that goes together. Now for NCLEX, what do you need to know specifically? Because this is what this lecture is all about, getting you to know what you need to know for NCLEX. Okay, as a nurse, you need to know diet, how you're going to educate the patient based on what they can eat, what foods, specifically really making sure you know what foods they can have. Exercise, what type of exercise they should do, how they're going to monitor their glucose, taking their insulin therapy, things like that. Drugs, specifically really the drugs, pharmacological aspect. You need to know all about insulin, the complications of insulins, the different types of insulins like your rapid, your short, your intermediate, long, and those peak times. And a little bit later in the lecture, I'm going to give you a mnemonic on how to remember that because it's a little complicated to remember, but hopefully the mnemonic will help you. And the drugs that cause hypo and hyperglycemia and different types of oral medications that your type 2 diabetics will take. So first, let's start about the diet. Now, diets in diabetic patients are very individualistic. It depends on how physically active they are, how they eat, things like that. So there's not a one-size-fits-all diet. They have to do some tweaking. Generally, it's a good guideline to follow the ADA diet, which is the American Diabetic Association diet. And here's what it says. What you want to concentrate on is the foods that are in each category and how much they can have of each percentage of each category. So carbs. A diabetic needs to consume at least 45% carbs in their diet throughout the day. So this includes like grains, those starchy vegetables like potatoes and corn. Those sweets have hidden carbs in them, like cookies and soda and dried beans and milk. Next are fats. This is the one you want to limit the most, no more than about 20%. And they want to limit those saturated, trans fats, and cholesterol. And those are found in foods such as lard, gravies, whole milk, fatty meats like bologna, sausage, hot dogs. And encourage, as an alternative, those healthy fats like the monosaturated and the polysaturated, which are like avocados, olives, and nuts. So teaching them how to pick healthy fats compared to unhealthy fats. And then proteins. They want at least 15% to 20% of proteins in their diet. And also let them know that meats do not increase the glycemic index, so that is good. And meats they need to eat, really try to avoid those red meats. They aren't as healthy, so you want to concentrate on chicken, turkey, fish, plant-based beans, egg whites, and low-fat cheese. Now let's go over the exercise part. Okay. The best type of exercise for a diabetic to do is the aerobic type exercise because this helps the body use insulin. So what type of exercise is best? Great test questions come from this. They'll give you an exercise regimen, which one's the best for the diabetic. This includes like those cardio exercises that require you to run and really get the heart pumping, like walking, running, and swimming. Okay, education pieces that you need to give the diabetic prior to exercising, because remember, they have issues with managing their glucose and their insulin. So prior to exercising, they want to check their blood sugar. And if their blood sugar is less than 100, it's a good idea to eat a snack, because if you're already starting out on the lower end and you're going to exercise, because when you exercise you use glucose, you're going to bottom out and experience hypoglycemia. So tell them to carry some simple carbs with them. Remember in the previous video we went in depth about simple carbs, and this is like hard candy, fruit juice, honey. In case they do get that hypoglycemic attack, they can just pop that in the mouth and help increase the blood sugar. Signs of hypoglycemia is they can be sweaty, clammy, confused, lightheaded, double vision, tremors. Remember the phrase, I'm sweaty, cold, and clammy. Please give me some candy. So that can help you and your patient remember what to do for hypoglycemia. Now, if they plan on exercising for a long period of time, it's a good idea to check their blood sugar prior to exercise, during, and after, just to monitor it, because you're going to be using a lot of glucose in the body. Now, prior to exercising, if the glucose is high instead of low, usually greater than 250, and there's urine and there's ketones present in their urine, they need to avoid exercising, because the body is already burning ketones in the system. It can't get to the glucose, so they don't want to exercise and burn even more ketones, cause some acid-base imbalances, which they can go into DKA and it would not be good, so they need to hold off. Now, what are some signs of high blood sugar? Remember the 3 P's: polyuria, polyphagia, and polydipsia. Polyuria is where you have frequent urination, polyphagia is where you're extremely hungry, and polydipsia is where you have frequent thirst. And just remember the saying, I'm hot and dry, I must be on a sugar high, because those symptoms are present in hyperglycemia. Okay, now let's get to the meat and potatoes of the lecture. We're going to go over medications. A lot of test questions come from here. What we're going to cover our oral medications, the medications that cause hyper and hypoglycemia, and insulin. Okay, but first let's talk about oral medications. Oral medications are typically for your type 2 diabetics, and they are usually started when the type 2 diabetic can't manage their blood sugar with either diet and exercise. Diet and exercise is the first things we want, and then they will be put on medications as a last resort. So let's talk about those. First one are your sulfonylureas. This is the most common types, and these drugs include glyburide, glipizide, dibenase, amaryl, and these drugs typically help you remember in IDES, like Zides, Z-I-D-E-S, Mides, M-I-D-E-S, or the Rides, R-I-D-E-S. And what these drugs do is they stimulate the beta cells, because remember your beta cells secrete insulin, to make insulin. But one thing you got to watch out for, this drug will cause hypoglycemia. And absolutely no alcohol. The patient should never ingest alcohol, drinks or anything like that contains alcohol, because you can experience extreme hypoglycemia, because alcohol already causes low blood sugar levels. So does this medication. You put those two together and you have a bad case scenario. So remember that with this drug, no alcohol. Next drug category are the drugs known as the miglitinides, and this is drugs that usually end in the G-L-I-N-I-D-E, like rapinaglinide, and these stimulate the beta cells to produce insulin, sort of similar as your sulfonylureas. And these are usually taken with the first bite of food. So an education piece, whenever a patient's on these type of drugs, but right before they eat their food, they need to take this medication. Okay, next is the biguanonides, and this is a very popular drug. As a nurse, I see this drug all the time. Metformin, that's a common drug of this category, also called glucophage. And what this drug does is it decreases the liver stores of glucose. And an education piece, you want to watch out for this, and even as a nurse working on the floor, this is usually held about 48 hours prior to surgery or before a heart cath, especially with the heart cath, because those dyes that they're giving during the heart cath, metformin and those dyes do not go together, and they can cause renal failure. So you want to watch renal function, and this drug can also cause diarrhea. Next is the alpha glucoside inhibitors. This is the drugs known as Precoce or Glycet, and this lowers the blood glucose by breaking down starchy foods in the gut. So, education piece with this is that you want to take this medication with the first bite of food since it works on the food you are taking in. The next drug category is a mouthful. It's called the thiazolidinediones, and these are also called for short as TZDs. And these drugs, a common one is glitazone, and it decreases the glucose production in the liver. Also, brand names Actos and Avandia. With this drug, however, you have to watch the liver function and the heart function because studies have shown that there may be an increased risk of MIs in patients who take these drugs. Now let's look at the drugs that can cause hypoglycemia and hyperglycemia. Okay, your beta blockers, those like metoprolol, atenolol, things that end in OLOL, they can actually mask the symptoms of hypoglycemia and they can cause it. Alcohol can as well, aspirin, those sulfonylureas that we talked about with the oral diabetic medications. You don't want them to take alcohol as well with those type of medications. Your MOA inhibitors, these are the drugs used to treat depression, and Bactrim, which is a popular antibiotic. So if your patient's on that, you want to watch out for that. Some drugs that can cause elevated blood sugars are the thiazides, like HCTZ, those are diuretics, glucocorticoids like hydrocortisone, prednisone, and estrogen therapy. Watch out for your oral contraceptives as well. Now let's hit on insulin. Okay, with this, what we're going to do is we're going to talk about some key points you need to remember with insulin, and then we're going to go over a couple mnemonics on how to remember what drugs of insulin are either rapid, short, intermediate, or long, and then give you some mnemonics on how to remember that onset, peak, and duration time. So first, let's go over the little side notes you need to know about giving insulin. Okay, whenever you're giving insulin, it's usually a sub-Q injection. The only insulin you can give IV is regular insulin. Remember that. It's the only one that can go intravenous. But whenever you give it sub-Q, and it goes into the fat, sub-Q's fat of the skin, and you want to rotate sides. You never want to use the same side. Rule of thumb, rotate sides out where you're not using one side more than one time within a 2 to 3 week period because they can develop lipodystrophy, which is pitting of like fat, and they'll get dimples in their skin and it'll mess up their fat layer. And typical sites you want to give insulin in is the abdomen, the armpits, or the thighs. Never, after you give insulin sub-Q, don't massage the area or put heat at it because this will increase absorption faster than what the body can handle, and you are going to have increased chances of having a hypoglycemic attack. So don't do that. And whenever you're mixing insulins, remember the little phrase clear to cloudy. Clear represents regular insulin and NPH represents cloudy. And how you can remember that is the initials RN for registered nurse. R represents regular, N represents NPH. So clear to cloudy whenever you're mixing those. Now, some things that can happen with diabetics who take insulin, these couple phenomenons. These phenomenons, people get confused. One's a phenomenon, one's an effect. And they both deal with high blood glucose levels, but they happen during different times in the night. Okay, so let's talk about the dawn phenomenon. Let the word help you. Okay, dawn. The crack of dawn in the morning. This happens during the waking hours. The patient's going to have hyperglycemia during the waking hours. And this is because the body, in preparation of waking up, the body shoots you some extra glucose because it knows you're going to need it for those waking hours. And this typically happens between 5 to 8 a.m. But the diabetic can't handle that extra glucose because they have issues with insulin. Remember, insulin helps take glucose into the cell. So in the morning, they're going to have really high glucose levels. To help combat that, just throwing on maybe a nighttime dose of NPH, which is an intermediate acting insulin, can help counteract that hyperglycemia whenever they're waking at the crack of dawn in those waking hours. Next is the Somgy effect. I like to remember this. Somji starts with S. For the sleeping hours, this happens whenever they're asleep. Typically, the hours between 2 a.m. to 3 a.m. And what's happening is that they're having a drop in blood sugar around these hours. And the body says, hey, we've got to fix this. So they release the hormones like cortisol, your catecholamines, and growth hormone to increase that blood sugar. But the diabetic can't cope with all that extra glucose because they have insulin issues. So what happens is that they get hyperglycemia. But to help counteract that, you want to prevent those glucose levels from falling between that 2 to 3 hour. So eating a bedtime snack can help that, or maybe decreasing that bedtime insulin dose. Okay, so now let's go over the different types of insulins. Okay, you have rapid, short, intermediate, and long. I like to remember it as ready, set, inject, love, because we're injecting into the diabetic, and rapid, ready, short, set, intermediate, inject, and L, love. So I like to remember that. Now, how I like to do this, you can just get a piece of paper whenever you're fixing to take your test, write out the word insulin, and from top to bottom, we're going to start at rapid and go to long, and we're going to make this correlate with what insulin types are in each category. Okay, so we have rapid. Remember, ready. So rapid, we're going to use the I in insulin. So R-A-P-D. Next, we have short acting for set. Ready, set. So the S. We have intermediate, inject I, and we're going to use the U. Intermediate means middle, so the U and the word insulin is in the middle, so that's going to represent our intermediate drugs. And one type of intermediate insulin acting drug is Humulin N. So we're going to put Humulin N, and I'm just going to put a line to help separate that and separate that from that. And then L for long, that's our last one's long acting. So we're going to write L for long. Okay, so now you have your categories. You have rapid, short, intermediate, the U's in the middle, so we know it's intermediate, and long. So now let's just add the types of insulins to help us remember. Okay, we're going to use the A. Okay, rapid are your logs, Humalog and Novolog. So we have Humalog here, and then we have Novolog over here. Okay, next we're going to go to short. What are short acting ones? All your regular insulins. So Humulin R, Novolin R. Ones that end in R are your regular. So we're going to remember regular. We're going to use the R in short. Just put reg for regular. And then we're going to go to our intermediate. These are our ones that end in N instead of R. So Humulin N, your NPHs, Novolin N. So we're going to use the N and just put NPH. And then we're going to go to our next drugs, which are the long acting. And this is the easiest ones, even when remembering peak and onset. And we know we have Levemir. And then we have Lantus. Okay, so that helps you remember what drugs are what, because on exams they like to throw out Humalog and you have to know the peak. So just write that out before you take your test and have that. And what helps you remember this is just rewatching this part of the video and writing it out over and over. It helps you remember which drugs are which. Now let's go over the mnemonics on how to remember specifically the peak and duration and onset of these specific drugs. Okay, now let's look at the different categories of insulins, the rapid, the short, the intermediate, and the long, and let's look at the onset, peak, and duration. And specifically what you want to know for exams are the peak times, because this is when the patient is most at risk for hypoglycemia. Now with these mnemonics, I wanted to make them nursing related, because chances are if you're watching this video, you're going to be a nurse, and helping things that are related to what you're doing help you to remember them. And each of these mnemonics is going to tell you whether it's rapid, short interacting, or intermediate, or long. and each number will correlate in the same order with onset, peak, and duration. So let's see what they say. Okay, rapid. These, remember, are your logs, your humalog and novolog. And the onset of this, the rapids, are 15 minutes, the peak is 1 hour, and the duration is 3 hours. So how in the world are you going to remember all this? Because in nursing, we have to get a little creative in how we can remember stuff. So remember this phrase. 15 minutes feels like an hour during 3 rapid responses. Okay, so clue, whenever you remember this, this deals with the rapid insulins. 15 minutes is the onset because it's the first number you see. An hour is the peak, and the duration is 3. Okay, next, let's look at short-acting insulins. Their onset are 30 minutes, the peak is 2 hours, and the duration is 8 hours. To help you remember all those numbers, remember the phrase, short staff nurses went from 30 patients to 8 patients. So short, you know, this is the short-acting insulins, and 30 is the onset, 2 is the peak, and the duration is 8. Next, intermediate acting. The onset is 2 hours, the peak is 8 hours, and the duration is 16 hours. Remember the phrase, nurses play hero to 8 16-year-olds. Nurses play hero, these are your NPH drugs like Humulin N or NPH. So nurses N, P, play, and H, hero, and 2 is your onset, your peak is 8, and your duration is 16. Next, long acting. Your onset, this is the easiest one to remember them all because there's only 2 numbers you have to remember. The onset is 2 hours. There is no peak with your long acting insulins like Levemir and Lantus, and the duration is 24 hours. So a phrase to help you remember this is, the 2 long nursing shifts never peaked, but lasted 24 hours. 2 represents the onset, long represents its long-acting, never peaked because there's no peak with long-acting, and lasted 24 hours is your duration. So that is the nursing management of diabetes. Now go take that quiz on my website, registerednursern.com, and test your knowledge. And be sure to check out the other videos in this series. And thank you so much for watching, and please consider subscribing to this YouTube channel.